initial suspicion is that there may be a problem with the management of these cases, particularly in the private sector. We have therefore instituted an investigation through the Department of Health to ensure that this issue is investigated further. This investigation must tell us whether the reason for this is due to the medical reason or the negligence. The Department of Health has augmented when it comes to the issue of testing and screening. The Department of Health in the province has augmented teams responsible for screening within the province. Some teams have been redeployed from districts that are currently having low infection rate to those that have a higher infection rate, such as eThekwini and iLembe. The Department of Health has brought mobile testing units to eThekwini to assist with fast-tracking the testing program. The University of KwaZulu-Natal has also offered to add their postgraduate students to boost the capacity, all of which we highly appreciate. To date, we have screened over 1 million people and tested over 11,400 people. We now have a ward-based screening and testing schedule, wherein we know which team will be where in a district on a day-to-day basis. We have to work on capping the infection among the healthcare workers. The total number of laboratory-confirmed COVID-19 cases involving healthcare workers is 121, because this number has grown from 108 last week. This is concerning because, as far as we are aware, all our qualifying healthcare workers should have access to the protective personal equipment that they need in order to avoid infection. It would appear that we probably need to further capacitate our healthcare workers in the correct use of PPEs. Fighting the growing stigma around COVID-19, we have noticed with concern protest by the people of Mtunjambili and the iLembe district. These are people who were angry because of admission of 10 patients who are COVID-19 positive at that hospital. As the Provincial Command Council, we are calling for an end to discrimination against persons who are infected with the coronavirus. Being infected with COVID-19 is not necessarily a death sentence, and there is no good reason to ostracize other members of the society just because they are positive. COVID-19 is something that has descended upon us and the victims. It is not their fault, and as a caring society, we must care for those in need of help to recover from this virus. We are busy preparing for the accommodation of patients in all areas of the province. In some areas, as it was the case with Mtunjambili, due to the low bed utilization, the department decided to use the facility for quarantining, isolation, and treatment of COVID-19 patients. It is deeply concerning that the people whom the community want to chase away are from the same district as them. So where those people must go. And I believe we would want to clarify that. It is important that we understand there is no one who is being moved from the district to another district, but people are being quarantined, isolated, and treated within their own district. Furthermore, the hospital's 24-hour gateway clinic, which is on the same premises, is still rendering priority health care services to all members of the public. We are calling for an end to the social stigma attached to the disease, as well as those who are affected by it. We need to stop that and accept that COVID-19 is here and it is part of our life and we need to manage it together. We need to elevate our knowledge and understanding on what its symptoms are, as well as what those who display such symptoms need to do. We therefore appeal to our fellow compatriots to calm down and desist from protesting, because gathering in large groups is in itself illegal, as it constitutes a violation of lockdown regulation, but also constitute danger to themselves because they undermine also social distancing when they protest. But we want to emphasize one point on this issue. Let us understand that this is not a problem created by those who have been infected. And this is a situation that has just engulfed all of us, and we should take full responsibility to work together so that we overcome the challenge. On the enforcement of intensified lockdown, we welcome the significant progress made by our law enforcement authorities in the apprehension of those who have sought to violate the regulations of the intensified lockdown. Since the intensification of the lockdown, a total of 1,082 arrests have been made by the police. We want to commend the law enforcement operations for upscaling efforts to ensure compliance with the lockdown regulations. There is a new trend by criminals of using funeral provision in the regulations to pursue criminal activities. In a highlight of just two recent incidents, Pongolo visible police members stopped a vehicle pretending to be a funeral parlor. They asked for a permit and were shown a vehicle pass permit that they are a funeral parlor carrying a corpse. The vehicle was then searched, and what was believed to be a corpse turned out to be 30 bags of dagga parcels that weighed 80 kilograms. The suspects were then arrested. Last night, in a separate incident in Underberg, COVID-19 police operation spotted a car also belonging to a funeral service. The car was stopped and searched, and liquor was recovered in the car. The suspects were also arrested. We are sending a strong message to all criminal networks that the law will catch you up wherever you are, and the law will catch up with you. It must be clear. On economic recovery plan and social relief, as we all are aware, the COVID-19 global crisis is ravaging the world economy and already having a detrimental socio-economic effect on South Africa in the following ways: increasing poverty levels, as many people require food, people losing their source of income, no visitors coming to South Africa, and therefore hotels have closed, with several workers not working and unable to sustain themselves. Several sectors of the economy have closed down or remain partially closed. Tourism events have been cancelled. People's source of income have been wiped away. There is a dire and urgent need for KwaZulu-Natal to recuperate the economic growth trajectory. It has become crystal clear that the South Africa's economic strategy going forward will require a new economic architecture and social compact among all role players, in particular the business sector, labor, community, and the government. We all need to work together to restructure the economy and achieve inclusive economic growth. We will, in the coming weeks, unpack and take the public into confidence about the economic recovery program for our province. On the celebration of the Freedom Day, tomorrow is the Freedom Day, as a national day that gave birth to a democratic South Africa. The Freedom Day is an occasion to engender social cohesion and national identity that is representative of South Africa's rich and diverse culture. As the province of KwaZulu-Natal, we will use the day tomorrow to appreciate the work of our essential services in various disciplines, including healthcare, law enforcement, emergency services, social workers, and all who have responded in the call to serve our people during this challenging period. We will interact with some of them tomorrow. The aim of this is to recognize their noble contribution and sacrifice in the service of their country and her people. I also invite all the people of KwaZulu-Natal to dedicate a minute of their time to send a message, pray, and thank all our essential workers. We thank you.
Thank you very much, colleagues. Let's quickly take the questions of clarity. We will then allow Premier MEC to also respond. You are first. There's always another. Let me take the first one. Bob, you are next. Jonathan, number 3. Ayanda, number 4. Then who's at the back? Number 5 at the back. I can't see because of the face mic, but I think you will introduce. Oh, hello. The veteran. Yeah, in that order. Thank you very much.
Greetings, Premier. My name is Koskona from I just have 2 questions for you and 1 for the NEC. The first question is, can you just get clarity on epidemic remaining under stress conditions? Are you in other words saying that unless there is a change, epidemic will remain in level 5? The second question is, you talk about an economic recovery plan, and while we cannot expect you to tell us all the details as yet as of the is there a working document or some sort of information that industries in Italy that are particularly affected by the lockdown can access that has been created in the aftermath of these recent lockdowns? For clarity. And to the MEC, we've seen developments in Gauteng and the Western Cape, which are provinces that are hard hit by COVID-19, like we are. What they've started doing is that they've started giving regular daily updates and by regions in terms of the new infections. I inquired about this to your department this week, about why KZN is not doing so, given the fact that we're receiving new updates, and they said, no, KZN is not planning to do that. Can we just get clarity of why KZN is not planning to do that? Thank you.
I'm partly covered going in Kozo, but Ilembe district is a major concern for you, Premier and the MEC. Don't you think you have neglected other regions when you focus too much at Chegweni and Kuguzoku? Because Ilembe has always been one of those districts and regions that was not really under the spotlight, but bearing in mind the latest figures, it's clear that you may have not focused too much on the development there. That's number 1. Cuban doctors are said to arrive in South Africa any time from today. Is there a batch in that group that will be coming to KwaZulu-Natal and will receive anything in that regard? Also, number 3, on the issue of stigma, Premier, don't you think that there is an urgent need for more educational campaigns? Because what happened in Tujambi is a case of people not having information and awareness about the quarantine sites. And also another one which is totally not related to this presser. You are sitting with a state-of-the-art hospital, a 3 billion beds and a hospital. Don't you think it would have come in handy during this time? When is it going to be ready? It's far behind in terms of its operational schedule. The cost has escalated. The question is, when is the hospital going to be ready, and are you planning to use it for quarantine during this COVID-19? I'll pause there for now.
Okay.
Jonathan Erasmus, just 4 points. What are your views on the eviction of Shackford as part of the municipality that's currently ongoing? And it's ongoing. Just can you give the provincial government a point of view of that? Perhaps this is a comment also for the Premier. Subsistence fishermen obviously have been very hard hit by all of this. In level 4, it does say fishing is allowed. Perhaps you can provide clarification for that in terms of what level of fishing is allowed. And for the health MEC, if you please get some further information on the reopening of when St. Augustine will be reopening, and obviously a further update on Kingsway Hospital and what's happening there transpiring. Thank you very much.
Okay. Next colleague. Ayanda?
And from the SHC, MEC, I just wanted to check in terms of emergency, you seem to have done well, over 1 million people have been screened. But what is the process now? When somebody does test positive, are you immediately taking them into a quarantine site, or are these people still going home? I ask this because we receive reports that there are workers from Cambridge, a butchery in Umgeni, where they were in contact with their colleagues who tested positive, and they've been seen, they're waiting their results, but they've been told to go home and self-quarantine. And so there's obviously dangers in people who are still waiting their results, could still turn out positive. Then also, I'm just looking at interviews with a number of people who are homeless. They seem to have some special permits that we don't have. Because of the numbers of homeless people that are walking up and down, and just the dangers of having these homeless people. They are scared. I know you put up the shelters, Moses Mabid there outside Albert Park as well, but they still escape. Going further to that, we've had concerns or reports of robberies that are caused by these people, and the Minister of Police did say that it's not something the police can deal with alone, and the provincial government needs to come in and help. So what are you going to do about the numbers of people that are homeless or homeless?
Okay. Sheila? Yeah, you can use your gadget.
Okay, thank you very much. My name is Sheila Msomo, and I'm from KZN newspaper. The Premier has said tomorrow will be used to appreciate the essential workers that are working during this time. But what I wanted to find out is that the healthcare workers have shown that they are not happy that they seem to have been excluded from the government economic stimulus package. Now, what I want to find out is that how is the government going to show the appreciation it's been for them to be on the forefront of this caring for the people that are affected by the virus.
Thank you. I'll hand over to the current answer.
Good afternoon, ladies and gentlemen. Good afternoon to the Premier. I have very few questions, I believe, that are coming to me. The majority is going to the Premier. The first question, Koskona, has been trying to ask, and in different ways, he's decided to get courage and actually ask it here today. We have indeed indicated as the Department of Health that we are not going to be issuing the statistics, and this is not a decision that came from the department. It's a decision of the Command Council that is led by the Premier and that has MECs in it. The issue was discussed, deliberated on at length, and the decision was not reached very lightly, and we had to agree on a process. And that is why today you heard that Premier was giving numbers, but it's numbers that were not really going down to the actual localities because of a number of issues that we looked at. And I think we are going to continue to do it like that because we believe that is what we should do. However, I think we need to call on all of us to focus on the important things. It's not important how many people are positive in eThekwini or eMgungundlovu or any other district, but the important thing is that as a country and as a province, we all are exposed to the virus. And the important thing is how do we as individuals play our role in ensuring that this virus is not spread, that this virus stays where it is, and that is the kind of messaging that we need to be getting out there. Because once you say in one particular area you only have 2, and you've got 50 in another area, and you emphasize on that, you run a risk of creating an impression that there are those that are more exposed or more vulnerable than others, and that's not what we want to do. So my call to you colleagues is that let us really focus on ensuring that the message we are giving to our communities is that all of us are at risk, no matter where we are, and we need to focus and ensure that we don't move the virus as we keep on moving around. Ayanda correctly indicates that homeless people are seen to be moving around, and by moving around like that, they themselves, firstly, are exposed to the virus, but they are exposing the rest of us because they are moving, they are likely going to move the virus around. So I think that's the important thing, and that's where we need to focus on. Spamandla, are we getting any Cuban doctors? Cuban doctors are going to be, in fact, it's not, this is the first cohort, I believe, of doctors that have been requested to come and assist. Minister indicated last week in one of his interviews. As soon as they arrive in the country, the National Department of Health is going to distribute them according to the need and the specialties that they have, and they will be giving them to the different provinces. So far, we have not had an indication of the actual number that we are getting as a province, but we believe we will be getting, and so will other provinces. In Tunjambili, well, it is quite unfortunate, and I think the Premier correctly has spoken to the issue of Intunjambili. Let me first indicate that there is no community in South Africa, certainly not in the province of KwaZulu-Natal, that has been consulted or requested permission that we utilize the facility that is in the environment for COVID-19. In fact, I don't think it was done in any country. Now, the government has a responsibility to make sure that there are beds available for those that are sick, and that responsibility pushes government to look at each and every facility that we have in the province and utilize it maximally so that we are able to provide the health treatment that our people need. Now, any hospital in the province, if it has the required kind of specialties, the beds that are needed, the isolation beds, the quarantining beds that are needed, if that hospital has those needs, we will be putting people there, because there is no way we can start going outside of our facilities and start paying more money when we actually have our own facilities within the localities. So it is very unfortunate that some people of Intunjambili, I'm saying some because it's not all of them, some people of Intunjambili thought that it's necessary to come and actually did what was done 2 days ago. But every hospital that we have at some point is going to be utilized for COVID-19. Because if we run out of beds in the hospitals that we have identified as fully COVID, then it means we need to start moving towards the other hospitals. Of course, when we do that, we are going to make sure that the staff is protected, the staff is aware what needs to be done. It's people who have the required skill that are going to be treating the people that are in those hospitals. But really, at no point is there a hospital that's going to be immune. I think that's one thing that we need to put out there. There's no hospital that's going to be immune. Once we run out of space in the other hospitals, then we start utilizing all our hospitals. Because hospitals, by their nature, are meant to take care of the sick, regardless of what sickness is there. So we are calling on our people to really come down and appreciate the fact that government is doing the best it can with the limited resources that we have. And what we've also agreed on is that those who have been infected with COVID-19 in a particular district, they must get treatment in that district. There is no person who's going to be moved to a different district and be treated there when there are actually facilities within their localities. Were we able to provide enough information to the people of Intunjambili about COVID-19? Well, likelihood is that most of us were caught by surprise. And when we started as the Department of Health to engage on a community program drive to make sure that all our people are aware, then the lockdown came in and we could not move further. But we did not stop there. We realized that people still needed information, and we said, let's utilize yourselves as people of the media. Let's utilize the media space, the radios, the television, posters, flyers, even loud hailing, that's what we've been doing, so that people understand what is this virus, what does it do, and what should happen, and what should we do as communities. So it is likely that we, as government, have not given enough information to everyone. But the reality of it is that things have moved so quickly, there was never enough time to go to everyone at the same time. Hence, we rely on the media. We didn't just rely on the media previously, we continue to rely on the media, because moving forward, that is how we get our messages to our communities. When is Pixley Kaseme going to be ready? This is one of the state-of-the-art hospitals that we have built in the province of KwaZulu-Natal. We had hoped that it was going to open at the end of March. We couldn't open it because of a number of challenges that the contractor they faced. However, it is part of the beds that we are going to utilize as Pamanda in this province. The hospital has 450 beds, and by end of May, we'll be officially utilizing the beds that are there, and it is contributing a huge number of beds in the needs of the province. So by end of May, it will be utilized. We'll obviously only have an official opening after this pandemic has passed, but we will continue to utilize it because it has actually, you're right, it has state-of-the-art equipment. It's a building that is actually going to be able to assist us in containing the pandemic. So we will be using it definitely. Reopening of St. Augustine and Kingsway, I'll put those together into one issue. I think I need to call on all of us not to be rushed, because if we want to take quick decisions and rush matters, then we start doing things in a manner that is not proper, and we are going to overlook some of the things, and a few months down the line, we'll come back and be kicking ourselves to say, actually, we should have given ourselves enough time to deal with this particular issue. I know that as the province, ourselves have been having a bit of pressure from the owners of that hospital to say they want to open, but we are not going to open the hospital until and unless we are convinced that proper channels have been followed. All the things that needs to be done have been actually conducted. It has been cleaned down thoroughly, and there is no virus anymore. Because when you now just open the hospital without following all of that, you are exposing not just the health workers, but you are also exposing patients that are going to be coming in, increasing the risk of infection in the whole of the province. And this is something we can't afford. So Kingsway and St. Augustine, we have a different process that we are following with them. They must be patient with us. Unfortunately, they have contributed a lot in the list of our infections. And that is something we can't take very lightly. We need to thoroughly investigate how did it happen that a private hospital that always says they have the best equipment, best protocols, finds itself with more than 71 health workers that have been infected. And you then go to Kingsway Hospital, which belongs to the same group, more than 20 healthcare workers that have been infected. Not even talking about the number of patients that has been there. So we are not going to rush this process. We have to thoroughly investigate, and as soon as we have the responses and we are happy that we can open, then we will do that, and we'll properly indicate to yourselves what has been done. And what is the process in relation to quarantine? The process really says once you have been tested, and then your specimen goes to the lab. If you are symptomatic, in other words, you have symptoms, then we must take you in and then put you in quarantining. But if you've just been tested but you don't have any symptoms, you probably don't even have history, we then say to you, go home, self-quarantine until we get your results. So in 2 or 3 days' time, once we have the results, then we come back to you as the Department of Health to say, look, these are the results and this is the way forward. But at any given time, this is a discussion that is always held between the patient and the clinician or whichever healthcare worker is assisting that particular patient. So if there are people who have been sent home to say, go self-quarantine, the likelihood is that they were found not to be symptomatic, or they might not have had a direct contact with whoever has been found to be positive. Therefore, they are seen for a couple of days that they could actually take off themselves. Of course, in other instances, we also have to ask you, do you have the capacity to actually self-quarantine? Because that's another issue. When we say capacity, we are saying, do you have a room that you can sit in all by yourself, no one comes in and so forth? And if you say you can't, then we take you in and give you the space. But other people are able to say, I can take care of myself. And where we are not sure, we go with you, we send whichever healthcare worker to home with you, and able to ascertain as government that in reality, there is a space for you to self-quarantine or self-isolation. So the process really depends on your state at that point and your capacity to be able to self-quarantine or self-isolate. Premier, I think those are the only questions that were relating to us. Thank you very much.
No, thanks. The first question I would like to respond to, will eThekwini remain under strict regulations? It looks like some areas will have to remain under strict regulations. Whether that will be a full lockdown or a partial opening of key industries is what we will be examining in consultation with both eThekwini and National. You might have noticed that when the stage 4 was announced, and there was an indication that which industries might be open. So we will look on that and the possibility. And you might find that going forward, you'll find that a particular industry will have to be closed or will remain closed because of its risk in terms of escalating the infection. So that is, it is not only eThekwini only, but also iLembe, as we are saying, is concerning us. And we might have to enforce the regulations more and more in such areas. Didn't we leave other districts, neglect other districts? I wouldn't want to agree with that view, because our program covered KwaZulu-Natal as a whole. But we then focus in eThekwini in the recent period because of the escalation of numbers. And therefore, it's not a question that there is any district that have been neglected. We're working in all areas. With regard to economic recovery plan, right now we have started engaging. There is a package, a document that we are discussing. It's a working plan. We will go back. We have, from Friday meeting, agreed that we must go back to have consultation with sectors. If you deal with the economy, you must look on it holistically, starting from being guided at a macro level. Then you zoom at your micro strategy, which then talk to each sector. And in this case, we'll be engaging with the tourism sector, manufacturing sector, the agriculture, and all other sectors that are key. And after that, we'll present a comprehensive plan. There should be a plan that talks to stimulation of the economy, the recovery. So you focus on existing industries and how you grow those industries. But also there should be, that plan should be linked to what was in place as a growth economic strategy. So we will be working on that shortly. There is, however, a toll-free number which is operating as part of the call center, where all people with issues and queries relating to business operations are encouraged to call so that they get more information. The question of Cuban doctors was answered, but I just want to commend Cuba as one outstanding country. They've always been there when the world is facing the crisis. Whether you will talk of North Africa, they were there during the era of Ebola. Those are compatriots who are dedicated to the cause of justice, the fight against injustice wherever it takes place. They are not confined by borders, but they go to ensure that they save humanity and humankind of this world. Stigma, I think MEC Masimilane Zulu covered it, but I would want to plead with all our people. With great respect, each and every area must understand that it has a potential to have people contracting COVID-19. And it doesn't mean that once you contract this, you die, but it means you need to go through a process that will help you to heal. And I think also in Ntunjambili, we'll have to plead with the people to understand this. And we agree it's a question of public education. And we will be embarking on more measures to ensure that the public is educated, and awareness is important here. The question of land invasion, it must be clear that eThekwini, it was not land eviction, but it was dismantling newly built shacks, illegal shacks. You come and build now. No, we will not agree with that. That will be taken down as you do it. So it must be understood in that fishermen, it's a point that is of concern to the people, but it goes with the stages. If stage 4, which I believe it allows them, and they will be allowed to work. But even the stage 4, it says partially or in full. So we will be announcing based on that. Homeless people, it is a fact that the issue of the homeless people is a problem. In eThekwini and in various areas, we've tried to provide them with accommodation, places where they stay, but they will be there for a day because they've been collected from streets. And once they are there, they'll be given food and everything, then they escape back to the street. Some of them will say, you are not going to give us drugs. They will go to that extent. And that's why those who are going away and get against the law must be arrested. We fully agree with the minister. We must work together as the province and the city and law enforcement agencies. We must all have a coordinated approach to deal with the issue of homeless people. The essential workers, while the issue of the package is intervening in sectors that are affected and in individuals. And the question of incentives with regard to healthcare workers and essential workers in general, I don't think we should elevate the matter to that level. Because even for police, we have not said we need to pay them extra. And almost everyone who is working, no one is going to be having any incentive on the basis of what is happening. So I think we must understand the sectors that are where we have had an intervention. The intervention seeks to cushion those who are seriously affected. And that is the situation. And we will request that we all understand that and work together. We are in a time where we need each other. We need to soldier on, consolidate all efforts we have to fight this pandemic.
Thank you very much, Honorable Premier. There's just one question from Nushera of East Coast Radio. She's requesting an update around Eddington Hospital and the issue of health workers that are affected there. Ayanda?
So I just wanted to find out also from the NEC, I'll be going back to patient care very soon, and we had a talk last time as the government to monitor the pension payouts. Some instances there inside the actual store that people were receiving their money, they were observing social distance, but unfortunately the queues outside. Have you met with the Department for Social Development and start to see how this time around you're going to be able to manage particularly the queues pension payouts?
Just for that.
Premier, given the fact that the current situation is like reintroducing the country into like a new start, is there any idea to decentralize economic hubs, which is part of the economic plan? And secondly, MEC, is there any plan to improve health facilities in rural areas? And probably as parallel to economic hubs in decentralizing, the idea of decentralizing economic hubs, is there any idea in place probably to incubate creative concepts so that they can be decentralized and placed in those areas where there will be new business hubs? Thank you.
Okay. Yeah, we are the last one. Oh, that's okay. Hey. Okay, let's take this, the last three. Okay, Kakasi, go ahead.
All right, within the landing pads for me, Kakasi. I'm not doing a cool. Yes, the lockdown intensify here in the province, especially the week. But when you go around locations, for example, the go to Zumago Nata, no, abantu they're still going around no man. And are there any plans now to intensify lockdown? Yes, we have seen you guys emgwaqeni engenela ngakhona, but ngaze sinibone ngaphakathi ke manje whereby abantu sababona nje beyimele amaqongololo. Angikhuluma ngento engihlezi ngiyibona ngakho ukuthi abantu basayimelana amaqongololo abanye futhi bayadayisa khona emgwaqeni odlula nje uyabona ama-roasted chicken. So unokwazi ukuthi are there any plans mhlawumbe ukuthi manje ningene ngaphakathi not ukuthi ningene emgwaqeni.
Okay.
What ENCA mhlawumbe mayelana nama-export fresh market lapha uyabonezempilo we-contracted by i-owner lapha kole nama-report ukuthi kunama-workers that were infected. If so, how many workers were infected? And also, did you advise that istolo letya mabasivale na? Nokuthi kuyiqiniso lokuthi bekusetshenzwa 24 hours also kulesiya stolo.
Okay. E-commerce. Last question, Jonathan.
This is the question for the MEC. Just because of what's happened, because of the lockdown, can we get some kind of idea of the pressure that's actually being taken off the health department in terms of having to deal with trauma accidents and the kind of incidents that would have normally happened from vehicle accidents and crime, and violent crime in particular? Has this freed up staff? That's an help to hospital workers. Thank you very much.
Right. Over to the MSc.
No, thank you very much, Pamanda. I'll just start with the last question. In terms of crime and so forth, that wouldn't be us who would have those statistics. But trauma, people who are coming in, it's certainly, the lockdown has certainly reduced the number of patients that we have seen in relation to that. We will be working on the statistics at some point, but definitely, and it has assisted us to redirect the resources to where they are needed the most. So that has been really a serious contribution towards ensuring that our people get the access and the nursing staff that is needed to actually address them. In relation to the community radio stations, Mr. Mabaso, I think, is one of the people, even beyond the Premier, who actually should be talking to us about that. But I know for a fact that we, as government, had approved with the Premier a program that was taking information not just to the big to the big radio stations, but was also targeting radio stations. On more than 2 occasions, I myself went and addressed community radio stations in a manner that was linking the majority of them. But I will leave that to Ubabu Mabaso. But I must indicate that we are very much committed as government in ensuring that we utilize our resources, not just community radio stations, but our newspaper, our community newspapers. And we made a commitment that we must utilize all those resources, because those are the people that are actually closer to our people, and that is how we get information very close to our people. So Ubabu Mabaso will speak to that, but we as government, we've made that commitment that is what we are going to do. In relation to Cambridge Supermarket, there is an engagement between ourselves and that particular facility. I'm not sure of the fact that they were working 24 hours. We are investigating. Let me just indicate that as of Friday, we received a formal complaint in relation to the supermarket. So we have then had to institute an investigation. But so far, 18 people have been found to be positive out of that case, and we are still out of that store, and we are still waiting for results of the others that have been tested. But it's not the only one. We've had to test. We've had to test checkers in Elembe, workers that worked for checkers in Elembe, and out of that, more than 50 workers were found to be positive. We then went and tested workers from Salt Rock Spa. One has been, the results have came out positive, but 86, we are still waiting for the results because we tested 87. Palito Spa, we tested 34. One has come out positive. We are still waiting for the results of the other 33. So as and when we get complaints and we get people who come forward, we go in and close. So Cambridge is expected to close because you now have found more than one person who has been positive, and therefore we need to establish the extent of the infection within that particular store itself. But you don't just establish the extent of infection, we also then need to clean the store itself. So they are instructed to close down, but we are putting an investigation because the issues that were raised in relation to Cambridge as well are a bit more than just one person being infected. There are allegations that were put against the management and how they managed the whole process. So we are working on that. Those are the areas that I have. There was also an investigation that we are there's another investigation that we are currently doing that relates to Oxford Fresh Market. We have tested people there. We've found one to be positive. We are waiting for 173 results because we've tested 174. So we are still waiting, and we've been able to get the workers in relation to that. Thank you very much. I think those were the only questions I got. If you can deal with the issue here,
there's just one from Blessing. Let me say, around how many people do we test a day?
Oh, for the whole province?
I think it's for the whole province. So maybe.
Well, let me just indicate this. On every single day, every district has its own team that goes out and tests people. So we will have a number of test results depending on how that particular district had functioned in that particular day. I'm just trying to find the numbers now. how that particular district functioned on that particular day. Let me give you a data for the 24th of April. For the 24th of April, in the whole province, we screened 41,047 people. That's the screening. And in terms of testing, we tested 1,885. That's in just one day. And now, if you work on average, then you take that almost every day. Yesterday, the districts were continuing to work. Today, as we speak, they are testing. So that is just on average how much we have done. But the Premier, when he was reading his speech, he indicated that as of today, cumulatively, we've screened more than 1 million people. So that is just within the past 2 weeks that when we have started to do the community screening and testing. Thank you very much.
Invite the Premier to read for us as a summary in Zulu.
No, thanks. On the few questions remaining, I think while MEC have indicated that Mr. Mabaso will also comment on the issue. We've had a number of programs focusing on community radio stations. And we'll continue to work with community radio stations because we believe that they are also part of the media establishment that need to be utilized to reach out to the people of the province. So we will work with community media. With regard to issues of the economy, yes, not only decentralizing, but this environment has also called for innovation. And it therefore means that we should ensure that we decentralize, firstly, the economy to various districts, but also ensure that we don't only end by decentralizing, we inculcate the culture of producing. And that's what we need to ensure. And that's why some have even suggested before that at school we must begin to have subjects that deal with entrepreneurship. And those are issues that we are considering. And part of what we must do is to avail resources even in rural areas such as Wi-Fi and all of that. So connectivity has proven to be one of the key demands during this time. So all of that are new lessons that we have drawn, which are going to influence the thinking and the approach we are taking as government as we go forward. Kafishane nje singakusho ukuthi KwaZulu-Natal ngolesihlanu sihlanganile futhi kwi-Provincial Command Council sibheka ukuthi izinga lempi ebhekiswe kwi-COVID-19 lihamba kangakanani, siyaluwina na noma kubheke ngaphi. Ngingasho ukuthi KwaZulu-Natal kulesi sikhathi isi-contributor about 21% of new cases kuzwelonke. And ngosuku lwayizolo nje umhla ka-25 ngingasho ukuthi la KwaZulu-Natal bese sinama cases awu-846 no-29 wabantu esebesishiyile ngenxa yalesifo. Kodwa futhi sibonge ukuthi abangu-241 abantu kulaba abawu-846 u-241 usurekhavile waphila usungcono. Into esiphethe kabi ukunyuka kwezibalo especially kwi-district yaseThekwini nakwiLembe. eThekwini iyodwa kuyakhombisa ukuthi usuku nosuku ama-cases abamasha abangaphezulu ka-10. KwiLembe kuyasithusa ukuthi kusukela ngesonto edlule kusho ukuthi kusuka ngomhla ka-22 kuya nje kumhla ka-25 kulezo nsuku kwilembe kubalwe ama-case angu-25 okuyinto ethusa kakhulu. So sizoqhubeka ke nomkhankaso obhekiswe ekutheni lezi ndawo ezimbili ziba isenta yecampaign eqinile eqinisekisa ukufundisa nokuvikela abantu bakithi kulesi sifo. Masisho ukuthi umongameli ngolesine uthule uhlelo okuthiwa i-risk adjusted strategy eshoyo ukuthi ngomhla